As a doctor, what are my top tips I give to patients that are embarking on a journey reversing their prediabetes and type 2 diabetes by reducing the amount of sugar, refined carbohydrate, and total starchy carbohydrate they're eating? Well, my top tips are: 1, expect to feel potentially fatigued for the first week or 2. This is as the body's switching from a sugar burning machine to a fat burning machine. It takes a bit of time. Go with it, let it happen, let the fatigue happen, knowing that after 2 to 3 weeks, energy levels will return, and often people will have more energy than they previously expected. Secondly is sometimes people can feel a bit lightheaded, and that's because as the body adapts, blood pressure can be temporarily dropped, and excess salt can be lost from the body. As the body adapts over those first 2-week period, the kidneys readjust and they stop losing excess salt. So what I often suggest to people is don't avoid salt like they might have done previously. It's okay to put a sprinkling of salt on the food. Make sure they're drinking enough. And if they're on blood pressure tablets, keep a check on the blood pressure, because it might be as the blood pressure improves, they can start to reduce their blood pressure tablets. Third, hunger changes rapidly or radically over 3 to 4 weeks. Some people may notice benefit within a week or 2. Other people may not, but then by 2 to 3 weeks, people are often saying things such as, I forgot to eat lunch, I was no longer hungry. And this is because the body's becoming a better fat burner, and it can access the thousands of fat calories on the body, and therefore people are no longer looking for food all the time. Fourth, I often say to people you can expect to see potentially weight or waist loss. I'm not a big fan of focusing on weight because I don't think it's the right thing to focus on, but people do notice it. And within 2 to 3 weeks, belt buckles are being tightened to smaller holes, clothes are becoming baggy. And often people notice a weight loss of around 1 to 2 pounds, or even up to 3 to 4 kilos a week in the early days. Part of that is fat loss, and part of it, certainly in the first week, is water loss. But many people can expect if they need to lose weight, they'll continue to lose around 1 to 2 kilos a week over the coming months. Next, we have a few problems that people can experience. So one is constipation. This is probably due to changes happening in the body with salts, also potentially a bit of dehydration and just changing dietary habits. The key I've found to helping people that get a bit of constipation is make sure they're drinking enough, make sure they're not underdoing salt, and if that still doesn't crack the problem, a simple over-the-counter magnesium supplement such as magnesium citrate, and just whatever the standard dose it says on the over-the-counter bottle, is what needs to be taken, and that seems to sort constipation out in most people. I always say to them, any bowel problems that go on for more than a few weeks, and certainly 6 weeks, isn't expected, and that might be due to something else. So if that happened, come back and see me, and we'll make sure it may be something nothing to do with your dietary change, and maybe another problem we need to deal with. So that's one of the common problems, constipation. Next, we sometimes have a bit of a headache. People get a bit of a headache. Not completely clear why that happens. It might be a sugar withdrawal, it might be a carbohydrate withdrawal, it may be a withdrawal from ultra-processed food. Typically, it doesn't last more than a few days, and adequate drinking seems to help it. Finally, many people changing habits can be a bit tricky, and I don't want to set people up for failure. So we always highlight that it's important to go with the flow. Every day is a new day. Know what you care about. Know what you're trying to do. Try to set your world up to support you. So biscuit tins at home may or may not be the most helpful thing in the world. Can they be removed? But actually, if you end up, things aren't going to plan one day, that's okay. This is zero judgment territory. It's all about learning or success. There's no failure with this. So that's what I tend to discuss with my patients if they're changing their diet for prediabetes. In addition, for type 2 diabetes, that maybe medication needs to be rapidly adjusted, and there's various resources out there for doctors to support with that. But with that, I would hope to see a patient after 3 to 4 weeks and then starting to see some significant benefits. And often I'm always interested in what their top tip is, because I learn from you and I can pass that information on to others.